Do you know how to perform a breast exam at home? If you don't worry, because you're not alone. Many people are unaware of this simple yet potentially life-saving practice. In today's world, where health is of paramount importance, knowing how to conduct a self-exam is a skill that can make a significant difference. Breast exams are essential for a couple of reasons. First and foremost, they aid in the early detection of breast cancer. The earlier breast cancer is detected, the better the chances of successful treatment. It's worth noting that breast cancer is not a rare disease. 1 in 8 women will be diagnosed with it during their lifetime. That's a staggering statistic, isn't it? But here's an even more remarkable fact. When detected early, the 5-year survival rate for breast cancer is over 90%. That's right, over 90%. Now let's pause for a moment and think about that. A simple routine that you can perform in the comfort of your own home could potentially save your life. It's almost like having a secret power, isn't it? A power that allows you to take control of your health, to be proactive rather than reactive. And it's not just about early detection. Regular breast exams also help you become familiar with your breasts. You get to know what's normal for you, and this makes it easier to notice any changes or abnormalities, should they arise. It's about staying one step ahead, about being in tune with your body. Breast exams are not a luxury, they are a necessity. They are not something to be done someday, but rather, they should be a part of your monthly routine. They are a tool in your arsenal, a weapon in your fight against breast cancer. So, let's make a pact. Let's promise to take care of ourselves, to be vigilant, to be proactive. Because when it comes to our health, we are our own best advocates. Knowing how to perform a self-exam could be a life-saving skill. Let's learn how to do it. So, when is the best time to perform a breast exam? This might be a question lingering in your mind. The ideal time to conduct an at-home breast exam is a few days after your menstrual period ends. This is typically when your breasts are least likely to be tender or swollen. This time frame allows you to get the most accurate sense of the normal feel and size of your breasts. If you're postmenopausal or your cycle is irregular, just choose a specific day, like the first of each month, to perform your exam. This regular check just once a month can make all the difference. It's about taking that small step for your health, for your peace of mind. It allows you to familiarize yourself with your body, to understand what is normal for you, so you can promptly identify any changes. Now that we know when to do it, let's move on to how to do it. Are you ready to learn the steps in performing a breast exam? First, let's find a comfortable place. Many prefer to do this step in the shower, as the water and soap can help make the skin slippery, therefore making it easier to feel for anything out of the ordinary. However, it can also be done lying down or standing in front of a mirror. Now, let's start with visual inspection. Standing in front of a mirror, look at your breasts. Notice their size, shape, and color. Look for any visible distortion or swelling. Raise your arms and look for the same changes. It's important to note that some people naturally have one breast that is slightly larger than the other. Next, we move on to the actual examination. Using the pads of your fingers, move around your entire breast in a circular pattern, moving from the outside to the center. You can also move your fingers up and down vertically, in rows, as if you were mowing a lawn. This up and down approach generally works best. Make sure to cover the entire breast area from top to bottom, side to side. This means from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Remember to apply different levels of pressure to feel all the different layers of tissue in the breast. You can begin with light pressure to feel the tissue closest to the skin surface, then medium pressure to feel a little deeper, and firm pressure to feel the tissue closest to the chest and ribs. Don't forget to feel your underarm area as well, as breast tissue extends to that part of your body too. If you're not sure how much pressure to use, talk to your healthcare provider or a nurse. In most cases, they can give you a sense of how much pressure is too much. Then squeeze the nipple gently, checking for any discharge. This includes milky yellow fluid or blood. Finally, repeat these steps for your other breast. Now, you might be wondering why all these steps. Why is it important to cover the entire breast area and use different levels of pressure? That's because breast tissue is diverse. It's not just one kind of tissue, but a mix of fatty tissue, fibrous tissue, and glandular tissue. Different abnormalities can hide in different types of tissue, which is why it's important to cover all your bases. So there we have it, a step-by-step guide to performing a breast self-exam. It might seem daunting at first, but with time and practice, it will become second nature. Remember, the goal is not to make you anxious, but to empower you with knowledge about your own body. Remember, practice makes perfect. The more familiar you are with your breasts, the easier it becomes to notice any changes. Finding an abnormality can be scary, but what should you do next? First and foremost, take a deep breath. It's important to remember that not all abnormalities or lumps are indicative of breast cancer. In fact, many are completely harmless, such as cysts or fibroadenomas. So don't panic. Your next step should be to consult your healthcare provider. They are trained professionals who can help you understand what you're dealing with. When you make your appointment, try to do so as soon as possible. But remember, don't let fear rush you into making hasty decisions. When you go to your appointment, be prepared to describe what you found. Is the lump hard or soft? Is it moving around or is it fixed in one place? The more information you can provide, the better your healthcare provider can guide you through the next steps. Your healthcare provider may suggest further tests like a mammogram or an ultrasound. These tests can give a clearer picture of what's going on inside your breast tissue. The results of these tests will guide the next steps of your journey, whether that's more testing, a biopsy, or perhaps even nothing more than regular monitoring. Remember, early detection is key in dealing with breast abnormalities, so even if you're scared, don't put off seeing a healthcare provider. Do your best to stay calm and collected. You have the strength to face whatever comes your way. It's also important to open up to someone you trust about what you're going through. This could be a friend, a family member, or a support group. You don't have to go through this alone. Finally, while you're waiting for your appointment or test results, try to continue with your normal routine as much as possible. Staying active and maintaining a healthy diet can help to keep your mind occupied and your body strong. Always seek professional help if you notice anything unusual during your self-exam. Remember, you're not alone in this. Knowledge is power, and by performing regular self-exams, you're already taking a proactive step towards your health. While self-exams are crucial, mammograms play an equally important role. But why, you might ask? Well, let's delve into that. A mammogram is a specialized medical imaging that uses a low-dose X-ray system to see inside the breasts. This test aids in the early detection and diagnosis of breast diseases in women. It's like having a superpower that lets you see what you can't see or feel with your own hands. The beauty of mammograms is that they can often detect potential issues before they've grown large enough to be felt during a self-exam. They can spot microcalcifications, tiny deposits of calcium that could indicate the presence of breast cancer. They can also identify different types of tumors, including those that are too small or deep to be felt. Importantly, a mammogram can give doctors a closer look at any areas of concern found during a self-exam. It provides a comprehensive picture of your breast health, allowing for a more accurate diagnosis. Now you might be wondering, when should I start getting mammograms? Well, experts recommend that women aged 40 to 44 should have the choice to start annual breast cancer screening with mammograms. From ages 45 to 54, it's advisable to get a mammogram every year. And once a woman hits 55, she can switch to mammograms every 2 years or continue yearly screening. However, if you have a higher risk due to factors like a family history of breast cancer, your doctor might recommend starting earlier or having them more frequently. It's always important to consult with your healthcare provider to make the best decision for your health. So, while self-exams are a vital part of maintaining your breast health, they don't stand alone. Mammograms are a powerful tool in your arsenal, helping you to detect issues early when they're most treatable. Remember, early detection is key. Regular self-exams and mammograms are your best defense against breast cancer. So, let's stand strong together in the face of this disease, armed with knowledge and proactive measures. Because your health is worth fighting for.